when you look at a place that is our size and you look at major needs in healthcare, so cancer, orthopedics, cardiology, and then you start to look at general care, the hospitalist service here, and the community medical providers who do primary care, you get great feedback from the patients, and they're the people who will really tout whether there is or isn't good care. And you look at outcomes and you look at surveys. I think we've generally been very, very consistent in the positive rates of recognition. I work mostly in the cancer center, so I can speak for oncology, and then I can speak for a lot of the things that are related, the cancer center itself, but palliative care, which is a big interest of mine and a big program that the hospital runs, as well as hospice in the community. We make a difference and we feel proud of what we do. We know that we can be innovative. I think that's the other thing about being small, is that if you're big, sometimes the red tape is a problem, sometimes there are just too many layers, and you can't feel creative, you can't feel like you're really making a difference if you're part of too big of a crowd. And one of the advantages, it's not really being a big fish in a small pond, it's just having the room to move and the room to be flexible. And that's what makes a difference, is people feel like they can really be an individual. Cancer is at the forefront of science in terms of new developments and advancements. If you look at the last 15 years of Nobel Prizes, probably 2/3 of them are in molecular biology, specifically related to developments in cancer, cancer treatment, cancer understanding. And that was one of the things that I wanted to be a part of. And when I was at Georgetown, people told me that there was no way any of this was going to happen in a small town. They literally told me I was going to melt when I came to Vermont and I would come crawling back to some big city. But what you can do in a small community like this with the support is you can bring all of the advances of modern science, of modern oncology, to a place like this and then apply it. And patients will benefit from that. I'll learn from that. And then as a community in the cancer center, we all grow. So it's a kind of a self-perpetuating phenomenon.